Good afternoon, everyone. This is Amanda Bruton. I am the owner of Medicare Answers Now, which is an FMO based out of Cleveland, Ohio. I hope everybody got back from Medicare Margaritas safe and sound. It's good to see all of your names. Todd, you don't know, but Medicare Margaritas was a conference that I did last week, and I highlighted GeoBlue and that everybody needs to have this in their portfolio as an option when talking to anybody that is traveling out of the country. So that's how we have so many that are here today, which is awesome. I did give them a little bit of a highlight and said, be prepared because you've got some awesome products and some great things to share. So guys, as normal, you can ask your Q&A by coming off a mute. I am going to mute everybody initially just so that way Todd can go through his presentation. You can also go through the Q&A and ask your questions there. But without further ado, I'm going to go ahead and hand it over to Todd. Thanks.
All right. Thanks so much. Yeah, I wish I could have been down there. It looked like I saw your LinkedIn. It looked like a great time. Welcome to the webinar today. Today, we're going to talk about a really interesting product. And as everyone knows, international travel is back. It's past the pre-pandemic levels. They're beating records from 2019. So you're traveling, your clients are traveling, and don't let them be without a product like this, something that has direct pay abroad, medical evacuation, repatriation of remains, access to a network, and as I said, direct billing. My name is Todd Taylor. I've been with GeoBlue really since the inception of the company. Wore a lot of hats, was involved in a previous role as the manager of our medical evacuations. So I actually saw exactly what we do, evacuate people in the event that needs to happen. And now I'm in the sales role, selling the product that I espouse and I love. And I love that. For those who don't know, GeoBlue is the international solution for all of the Blue Cross Blue Shield companies. So in Ohio, we work with Anthem. In Texas, we work with HCSC. In Florida, Florida Blue, and accordingly. And the goal of the product really is to help the individual traveler, no matter where they are in the world internationally, help them identify, access, most importantly, help them pay for international health care. There was a situation last weekend. There was a Blue Cross of Michigan member who had a Medicare Advantage plan. The plan did not cover anywhere outside of Michigan. This person did not have a GeoBlue plan. They were in the Dominican Republic. She broke her hip. It was a nightmare. It cost $68,000 for her to get back. The transportation, the medical expenses abroad, they had to pay for that all up front. They had to set up a GoFundMe, max out the credit cards. Don't let that be your client, especially seniors. Don't let that be your client. She could have had a GeoBlue plan probably for around $60 for the week and had a $0 deductible, $1 million medical limit, direct pay. All of that $68,000 claim would have been covered. Don't let that be your client. It's a common fallacy that people just think their domestic health plan will cover them effectively when they go abroad. Domestic health plans were not necessarily meant to cover or incur international claims. Medicare products on a Plan F or Plan G on the supplement side is $50,000 lifetime. It's emergency only. It's $50,000 lifetime. It only covers at 80%, and it has a $250 deductible. GeoBlue can pay as primary, has a $0 deductible, $1 million medical limit, access to direct pay. ACA plans, as you know, are very limited for international coverage. And then a group plan, you might have some accident and emergency coverage on that if you are part of a Blue plan. If you're not part of the Blue community, you likely have very limited international coverage. So anyone traveling abroad who's a US citizen or US resident is an opportunity for these products, and we'll discuss the product shortly. As I said, international travel is back. Everyone's going somewhere. The planes are packed. And according to this numbers from July 2022, they're back over 100% from 2019 at this point. Seniors traveling abroad, as I mentioned, don't let your seniors go abroad without knowing the limitations in most Medicare products when they cross the border. networks shrink, their coverages shrink. Again, 50,000 lifetime. There's no direct billing with that. A senior will have to do everything on their own and then try to wrangle with the private med sup company to get reimbursed. With GeoBlue, we can pay the claim directly, $0 deductible, $1 million medical limit, and we can arrange direct pay. If they need a medical evacuation, we'll arrange and pay for that. If someone passes away overseas, we can arrange and pay for a repatriation of remains as well. We have great pricing points for seniors. There's a multi-trip plan that's around $300 for the entire year, and they're guarantee issued to age 95. And almost all of these plans can be sold online within minutes.
Todd?
Yeah.
Is there a plan for parents coming from another country to the US for a vacation? They are not US citizens.
There will be soon. We've been working on this visitor product for a while. I do suspect we'll have it this year. So the long wait is at an end. Yeah.
Thank you.
Medical evacuation, repatriation of remains. These are two high dollar services that are not covered under domestic health plans. They're not covered by Medicare, and it happens more often than you think. We were doing at least 4 to 5 medical evacuations a day when I was in the evac department. We've grown a lot since then. We're doing a lot more now. So this happens more than you think, and there's no IOUs. If you need an evac and it costs $37,000, there's no IOUs with that. You have to either pay by credit card, cash, or have something like GeoBlue that can work on a direct billing scenario with the medical assistance or evac partner. So you got to be prepared for that. GeoBlue is an international health insurance plan, but it also is a technology policy backed behind the insurance. So you can arrange direct pay for covered services, drug equivalency guide. If you have a senior or under 65 person who's on a lot of medications, they can translate or they can put into the app exactly what the drug is, and it will translate country to country so they can make sure they're getting the right medication. Translation of medical terms. If you end up or your client ends up in a facility where no one speaks English, you can put into the app exactly what you're trying to say, and it'll repeat in that target language: Spanish, German, Italian. I have COVID, I think I have a headache, my stomach hurts, etc. Understanding your health and security risks. We have members right now in the Ukraine, we have members right now in Russia, and they're getting real-time information, street by street, block by block, about what's going on. Mobile ID cards, and then e-claims as well. If you have a relatively low dollar claim and you just want to take care of it then and there, your client does, you can take a picture of the claim, you can file it through the smartphone, you're probably reimbursed by the time you get home. So again, all of this is ancillary to purchasing a GeoBlue plan that you obtain. GeoBlue mobile app, it's rated one of the best apps out there that you can download once you become a member, and you can do all of these things I just listed right through the mobile app. And then also about 2 years ago, we added for free a telemedicine service called Global TeleMD. We are the only international carrier on the individual side, the retail side, that has a telemedicine service. So once you become a GeoBlue member, you don't want to go outside because of whatever reason, you can connect with a physician through Global TeleMed or Global TeleMD, excuse me, and you will be connected within 24 hours with a physician. So again, this is a free service that accompanies all GeoBlue plans on the individual side, and no other international carrier has that.
Todd, next question.
Yep.
Is there a plan for international students coming to the US to attend college and play intercollegiate sports? If yes, is there a limit on the coverage for the NCAA sport injuries?
No, there's no limit, and there is a plan. It's our Navigator plan. They have to be here 3 months or more, but we do cover sports. We do cover intercollegiate sports, and we do cover alcohol and mental health and things like that. So yes, we do have a plan for that.
Next one. Does one need to have a Blue Cross Blue Shield health plan to get GeoBlue?
You do not. Any US citizen can purchase a GeoBlue plan.
Awesome. And for those of you that are late on arrival, we are recording this. So I will load it onto YouTube and we will put on social media. So stay tuned. That normally happens about a couple of hours after the webinar. Next question. Are there any plans for skydivers?
Skydiving is an excluded service on our plans, unfortunately.
So Karen, you're out. Sorry. Karen skydives a lot. Do you purchase for your trip 10 days, or is it an annual policy that you can purchase?
It's both, and we're getting to the products right here.
Okay, so everybody sit tight, let them run through all of this, and we will be good to go.
Yeah, so we'll start from the left here. The Voyager Plan, this is our single trip plan. You're going to Aruba, for example, you're going to Aruba for a week, you can buy it for a week. If you're in Detroit and you're going across the bridge to Canada for a day, you can buy it for a day. This is guaranteed issue up to age 95. It's guaranteed issue up to 182 days. So you can buy it for a day, a week, a month, up to 6 months. It covers accidents, injuries, and illnesses abroad. Average price on this product is around $100 per trip. No excluded countries, go anywhere of your choice. Will cover most pre-existing conditions if you have a primary plan in the US. That can be ACA, a corporate group plan, or a Medicare product. If you have one of those, we'll cover most pre-existing conditions when you travel abroad. So textbook example there, if you have a heart condition, you have a massive heart attack abroad, we will cover that, get you home accordingly. The premiums are based on age and length of trip, okay? It's spring break right now, okay? If you're going to Mexico for a week and you're 18 years old, you're probably paying about $1 a day. If you are 90 and you're going to Italy for 4 months, you're probably gonna pay $20 to $25 per day. So it really depends on age, length of trip. All of these plans cover medical evac, all these plans cover repat of remains, all these plans cover COVID. Okay, if you get COVID abroad, we will cover that as part of our plans. Okay, this is a single trip plan. It's designed for someone generally going abroad 1 time per year. So who can buy this plan? Any US resident or US citizen can purchase. We have this plan in 47 states. The only states we do not have this are Maryland, Washington State, and New York. Okay, all the other states, this product is available. The second product is our Trekker plan, and it's designed for someone going on multiple trips per year. Okay, the first one's a single trip. This one's now a multi-trip. Textbook example here is maybe a senior who's going on 2 to 3 trips a year. They buy an annual plan. They can take unlimited trips. No trip can be longer than 70 days. Another good example would be if you're working maybe with a small group and they have a couple executives maybe that go to Mexico once a month. Instead of buying 12 single trips, you'd buy 1 multi-trip plan for the entire year. It has a great pricing point, around $300 for the entire year. It's guaranteed issue also to age 95, and they can take unlimited trips, okay? The third product here is a long-term plan for 6 months or more, and it's called, if you are living abroad 6 months or more, you're termed by the tax code as an expatriate, okay? You're living abroad full-time. This is our expatriate product, our Explorer plan. It's designed for someone living overseas 6 months or more. So an example here could be, maybe you're working with an employer group. They say, we have an executive of director of supply chain. We're sending him to Shanghai. He's going to work there for 2 years. He's bringing his family with him. He's going to be in Asia most of the time. Maybe he's coming back to the United States 2-3 times a year. This product will cover inside the United States under the Blue Card PPO. It'll cover outside the United States with GeoBlue as part of one plan. This is a comprehensive major medical plan, much more ample benefits than the first two, which are more accident and injury and illness. This one has mental health, physical therapy, wellness care. It really is a major medical plan. Unlimited lifetime maximum. It can also work inbound as well. If you have a foreign national who's coming to the United States to work 6 months or more, they can't be visiting. They have to be working here 6 months or more, and then you can write it inbound, and then it would give them coverage through the Blue Card PPO. And then the fourth product, I was asked about students earlier. This would be our student product as well as for mariners and missionaries. If you have an inbound student, a foreign student coming to the United States to study here 3 months or more, you could write them on the Navigator plan, and it has coverage for domestic coverage with Blue Card. It'll even cover them in their home country. It also works outbound as well. You say, my kid's going on a grad program to Barcelona, he's going to be there for 2 years. Okay. Also works with missionaries, also works with mariners, someone maybe working on a boat. Probably see that more in like the California or Florida markets. But the other major difference with these two products on the long-term side versus the first two I spoke of is that there is a traditional medical underwriting component with these longer term plans. There's a series of health questions, and then based on how those health questions are answered, someone can be rated as is, someone can be rated up for a particular condition, someone can be declined accordingly. Our decline rate, though, is roughly only 4%. So just remember, the first two are guaranteed issue. The second two have health questions. There can be a rate up, there can be an accept, there can be decline, sort of like the old rules pre-ACA. I see there's probably some questions, Amanda, or if not, we can keep going. Okay. So just so everyone understands kind of the value proposition and exactly what I'm talking about here. So just some short-term examples here. 19-year-old going to Greece for a semester, 113 travel days, $0 deductible, $1 million medical limit, $203 for the entire trip. Okay, no brainer, $1.80 per travel day. 45-year-old business person going back and forth to Germany, 175 for the entire year. Okay, very affordable these plans are, but they pack a high degree of value should something happen. And then seniors all day. You want your seniors protected when they're traveling abroad just because of the overall limitations in Medicare products. 10 travel days, $81 for the entire trip. And then a 68-year-old maybe taking 3 trips, $460 for the entire year. Okay. So everyone understands, here's our case study. This was a young lady who got herself into a very severe ATV accident in Lombok, Indonesia. She was studying abroad in Australia. She took basically a few days to go to Lombok. She had a very severe leg fracture, and she could not have surgery locally just because of the standard of care. So the recommendation was to transport her by air ambulance to Singapore. We arranged the air ambulance. We arranged the ground transport. We arranged an orthopedic surgeon to do the surgery. She was admitted there for about 3-4 days. And then we were able to get her back to Australia, where she actually continued her trip. I gave you the 1-minute version of that, but this was a very complex case with a lot of moving parts. $12,000 almost for the medical services. Air evac, $25,000. Again, that has to be paid direct. There's not, some sort of, do the evac and we'll pay you later. It has to be then and there. And then $1,500 for bedside visit benefit. We arrange if someone's expected to be in the hospital significant amount of time, we arrange for a loved one to be with them. So $39,000 in costs, every penny direct billed to GeoBlue. Her premium was $190 for her international stay. So again, high value, and the premiums, especially on the short-term side, are very affordable.
So we have a few questions. If someone has a green card, can they get it?
The green card is a resident. Yes, they can.
Okay, next one. I do not know if this question's already been asked. I am licensed in just one state. Can I write GeoBlue policy for individuals that live outside of the state that I'm licensed?
The answer is generally yes. There are a few states where you do need to be licensed, and I think I can rattle them off the top of my head. Texas is one of them. Minnesota is one of them. There are a few others, or it's a handful, but generally, yes. If you're in Ohio and you have a client in Kentucky, you can sell to that individual. If you are in Michigan and you have a client in Wisconsin, you can sell to that individual.
Which states are you in all states, or are there states that you do not offer this product?
There are 3 states we don't offer the product. We don't offer New York, Washington State, and Maryland. Every other state has the same products with the same names, the same branding. So it makes it very, very easy.
Awesome. Is the Explorer plan considered creditable coverage for Medicare purposes?
It is not.
And last one, is the coverage for travel companion, for example, to be evacuated as well?
Most of the time, there is room on the air ambulance for a companion. It's completely subject to the pilot, though. If there's no room, they won't be able to go. But generally, there is room for someone to accompany the individual.
Awesome. Thank you.
You can get appointed to sell this product today. It's very easy. You just go to this link, this URL right here, and sign up. When you sign up, you will get a confirmation email back. In that confirmation email is your coded URL, your coded link to sell the plan. You can put that link on your website, your agency website. You can put it out there on social media. You can blast it out to your clients. Anyone who goes to that link, your link to buy, that's how we code the sales. And what's great about this product as well is I had someone contact me yesterday and they said, we have sales from you guys and we don't know any of these people. And I said, well, what likely happened is someone that you did know forwarded it to someone else, and then that person likely forwarded it to someone else. So the more you get that link out there, think of it like an octopus or something. The more you get it out there, the more people you're going to tag, and it will actually install a cookie on your computer or on your client's computer, and you'll have that client essentially for life unless they clean their cookies, which a lot of people don't do. So here's the URL here, GeoBlueTravelInsurance.com/TLC. Just go there. You can sign up today. You can get your link today. There's no continuing education with this product. There's no AHIP or anything like that. Once you're appointed, unless you lose your license or something, you're essentially appointed with us. And if you change agencies, we can always update that information for you.
So a few more questions. Can I provide this to travel nurses?
Yes.
There you go. Awesome product for that. They can be written pretty quickly, so it's awesome. Can you get brochures? Yes. It's through their portal, which I'm sure that Todd's going to go through.
Yep.
What are the options for New York residents? Do you have any?
Yeah, so that's a good segue here. So in New York, we do have a product, and it will actually automatically take you there. So when you're quoting GeoBlue, if you put in a New York zip code, it will take you. You see here it says HTH quotes. So our company, before we were trade named as Blue, before we were essentially bought out by the Blue Cross Blue Shield Association and other Blue plans, we were called HTH Worldwide. So we still have an HTH product in New York, Maryland, and Washington State on the short-term side, the single trip. So if you put in a New York zip code, your client will be geared towards the HTH single trip product, and they can purchase that. So it's not like New York residents have nothing, it's just not GeoBlue. And that'll be automatic. They don't have to do anything.
In session. What about if you're on a cruise?
Cruises are not excluded. I get a lot of questions about cruises. They're not excluded as long as it's an international cruise. Caribbean cruise, Mediterranean cruise, Baltic cruise. And an Alaskan cruise, I would not sell this product for. And the reason is you're always going to get into a situation about where did the injury occur? Did it occur on the Alaskan side? Did it occur on the Canadian side? Because there's no coverage domestically for the short-term products. So as long as it's an international cruise, that's fine. We don't cover in Puerto Rico. That's part of the United States. We don't cover in U.S. Virgin Islands. That's part of the United States. So just be clear on that.
Okay. Next question, and I'm going to answer it. It says, do you run this through an FMO or contract direct? The link that Todd provided was the link to run it through me. And TLC. So that's the link that is up there. If you want to run that through your FMO, talk to them. Odds are they have it, and they can provide you the link. That's not a problem. The next question, would one of these plans work for families that live and travel in an RV throughout the US and only stay in certain months for a month or two at a time?
It would not. No.
Okay. And then can this product be offered to international commercial pilots?
A pilot would, so if it's a group plan, maybe we could do it on that side. On the individual side, we cannot. So we have an entire corporate group division as well. So if you have a group of pilots, maybe they could work something out on the group side.
So I'm clear, there are not first dollar payer. However, they will pay and then work with the client's primary insurance to work out who pays the claims.
We will pay as primary abroad as long as the client takes advantage of the direct pay feature, which is the overwhelming majority of the time. We are filed as secondary, but we pay as primary. So for example, say someone's hospitalized, they contact GeoBlue and they're hospitalized, and we will reach out to the hospital and we will try to arrange direct pay. If it's a network hospital, we can arrange direct pay automatically, assuming it's covered. If it's a non-network hospital, we may have to negotiate the pay arrangements with them, but we're pretty good at that because the hospital doesn't want to be left with the bag on the bill. So they will likely work with us and we can arrange direct pay with them. The bill is sent to GeoBlue directly. We don't really subrogate that much against the primary insurer. I'm not saying that it couldn't happen, but we generally do not subrogate with the primary insurer.
Contracting question. Does each agent contract individually, or can my downline agents contract under the agent? Are there overrides for agencies?
I can talk about that offline. There's not with this contract here, there wouldn't be a downline per se. If they're internal agents, we can set them up at zero comp and then just pay the agency. But if there's, something big in terms of a downline, that can be discussed offline.
Next one, is there coverage for trip cancellation?
There's a limited trip cancellation coverage on the GeoBlue plan. With our HTH product, we do have a full trip cancellation line, and it can cover a trip up to 50,000. I don't mention that product much on here because this is a, as everyone knows with the Blue rules, it's very clear in terms of branding. So I don't mention HTH very much, but we do have an HTH product for trip cancellation that I can share with you. You do have to be licensed in PNC though to sell that.
A cruise that is part national and part international, would it cover the international part only?
So again, I would not sell this product for an Alaskan cruise. If you're in the Caribbean and you're in Puerto Rico, you would not be covered. If you go to, Dominican Republic, Aruba, anywhere outside the United States, you would be covered. This plan does not cover domestically on the short-term side.
Is it best for the client if something happens to call and find a hospital that would be in network?
They can call if they wish. They can also, once they become a member, you can see the network in full. You can see everything that's in network, but also it's important to note there's no penalty for going out of network either. You can go to any hospital of your choosing. There's no penalty for going out of network.
If admitted to the hospital out of the country, would you show this plan card, your health card, or both?
This plan.
Okay, awesome.
Okay, here's just the sales dashboard here, the agent hub. You can view your sales. Here's your link. If you need to get your link, this is the link that's coded to you. We do webinars all the time. We have great testimonial videos. Absolutely check out our marketing. Like there's emails and newsletters that are already customized that include your link that you literally can just download and blast out to your clients. You don't have to really create anything. It's all there. There's banner ads for you. There's social media posts that include your link. There's a lot of things you can do without a lot of hard dollar marketing to promote this product. Here's my team's information. If you have any questions, you can contact them. You can contact me. Happy to help. I am backed by a full broker support team as well, and we just hired a bunch of new people for broker support as well. So we're fully staffed there. And I do want to, I know there's probably more questions, but I do want to show everyone how to quote. So let me share. Let me get out of this. Can everyone still see my screen? Amanda?
Yes.
Okay, great. So let me go to, let me take everyone to, we're rolling out a new website, and I want to show everyone just how this works. So everyone should see here, GeoBlue, Cover Your World. And I just want to show everyone how to quote. So when you get your link, it'll be geared towards this site, okay? Quoting this product is very, very simple, okay? You put in the travel dates. So say you have someone, let's say we're going away from the 14th of April, and we're going on a nice little trip here, and we're coming back maybe May 3rd. Okay, it's a nice little trip. We have, let's say we have a 40-year-old, let's say we have a 39-year-old, and we have 2 young kids. Okay, we'll just make a nice little family here. Then you put in the zip code. Okay, get a quote. This is the trip cost for the entire trip. It's not per person. It's for the entire family. Here it shows what it is per day. So it's $2.25 per person for travel day. You can change the medical limit. There's 4 options there. You can go to $1 million, you can be 50,000. There's also 4 deductible options as well. So you can go back and forth on what you want. And then if you want to, just share it with your client, you just do share quote. Okay, you put your client's email, their name, if you want to send them a note, and then send it. If they want to kind of toggle around they can read about the network, they can read about what we do, the benefits. But what's great about this now is the quote will now follow you. Before it didn't do this. The quote will now follow you the entire time. So when you want to buy, you just click buy now. So you can do everything you want. You click buy now, and then it'll ask you demographic information, the credit card, and that's it. I timed myself doing this, and I got a quote and bought within 5 minutes. So it's a very easy product to sell, also to buy. Any additional questions?
Can you flash the partner program phone number again?
Yeah, hold on 1 sec. Here it is. 844-669-8743.
What about traveling with my mom that lives in another state? Would she have to get her policy separate from my family?
Yes.
Okay. Other questions that you guys have? What about commissions?
Commissions are 15%. GeoBlue will pay them to you directly. And commissions are generally paid the second week of the month after the sale. So if you have $3,000 in sales in the month of March, you'll be paid them basically the second week of April.
Can you test drive some of the marketing tools, please?
Yeah. So let me get into my Agent Hub here 1 second. So if you're in the marketing area, if you're signed in, I'm just logging in to Anthem. This is just the Anthem website here. If you're in the marketing area, you would go up to marketing, and then you can actually see the network from here if you want to look who's in the network. And then there's an entire GeoBlue marketing materials portal. So you could look up individual sources, which is what I do, corporate group, and then you can go accordingly. But also, I also send every new agent a bunch of marketing materials. Use the flyers, they're the best thing. And then also use the testimonial videos. They're 2 minutes long, and they give a really nice summary of what we do and how we essentially save this individual from their life, but also from financial ruin. So use those testimonials, and everyone was like, watch this 2-minute video, and I guarantee you that person buys. So that's how I would market it. Yeah, we can get you brochures, but I think the testimonial videos are so much more powerful than any brochure. So here's the brochures you can download. You can put your information. Here's a senior brochure. So we have a lot of stuff that you can download here.
There are some trips that require insurance, like a trip to the Galapagos Islands. How far out can we write a plan for that trip?
You can buy any plan up to 24 hours before you leave. At most, you can buy it 6 months before you leave, but it has to be on the short-term side. It has to be before you leave.
Okay.
You can't, be in Germany buying your plan in the ER, when you're bleeding out of your hand or something like that.
Okay. Do you have any marketing materials that are in another language other than English?
We have Spanish marketing materials.
Okay. Can you put testimonial videos on social media with the URL to purchase?
Yes.
Is that allowed?
Mhm.
Yes. Okay.
That's allowed. Yes.
Any part of the world that is not covered?
Short-term plans have no excluded countries. Long-term plans, there are some exclusions. Generally, we have a list for that. Generally, war-torn areas, Iraq, Syria, Yemen. So there are some exclusions there.
Other questions that you guys have? You guys are a lively group today, and that's awesome.
Yeah, no, these are good questions.
Going once, going twice. So Todd, one, I do need materials sent to me. I've blown through everything that I had here. So if you wouldn't mind, that would be awesome.
Yeah.
And then next year, I announced last week that we've already got the 2024 Medicare Margaritas set up for March 11th to the 13th. So next time, hopefully you've got to get that. Can you flash the contracting link on the screen again, please?
Yep. Contracting is here. GeoBlueTravelInsurance.com/TLC.
Yes. Awesome. Does GeoBlue have a program to comp travel agents? Wondering if they would be a good referral partner.
So the issue with travel agents is that they have to be, this product requires a health license, and generally travel agents are not licensed. If they are licensed, we can comp them. If they're not, we can't. So that's sort of the issue there. A travel agent usually does not sell a product like this. They usually sell what was referred earlier, a trip cancellation policy. Trip cancellation policy is insuring your trip. It's not insuring your health. They have very low medical limits, generally like $10,000, right? Whereas GeoBlue is insuring the medical.
Which, guys, I can tell you personally, and I know some of you heard me say this at the conference last week. My dad has done several transatlantic cruises and gone all over the place, and I have him buy these plans from GeoBlue regularly just to make sure that he's covered and that he doesn't have to worry about a thing while he's traveling. So it is good enough for my family. I do recommend it. And I do think that, considering that you do want to have the conversation with your client, do you travel, and then ask, key question anytime that you're having that sales conversation. Do you travel? And if so, where are they going? They'll tell you, and then have the conversation. Next question, Todd, how does this compare to other plans like IMG?
Yeah, so IMG is a competitor plan to us. They're a good company. They've been around a long time. There are comparative differences, though. If we have very strong pre-existing condition coverage, they have some significant limits there. So you definitely want to check out the certificates on their pre-X look back. Another comparative difference is on the direct billing side, they're more of a paying claim scenario, whereas GeoBlue has an international PPO that can direct bill. So but again, IMG is a good company as well.
Any other questions? Going once, going twice.
No, Amanda, I was just going to add something if I could.
Sure.
I jumped on here because I wanted to just see if there were any details that I wasn't aware of. I always find it nice to have a refresher because I absolutely love GeoBlue and I sell it a lot. But one of the things that I've started doing when I go through a presentation of an Advantage plan or a supplement is, at the point in which we're talking about specifics and it mentions international travel coverage, I always do a little sidebar and say, by the way, this is not enough coverage. And then we have a quick conversation about that. And it almost always shocks people. They have no idea that this is a situation where you don't have coverage. And so it works perfectly in, in the course of the discussion of both of those products. And then they always have it in the back of their mind. And then I often will have people come back to me, a couple weeks later, a couple months later and say, hey, you mentioned that. So it's an easy way to work it into the presentation.
Awesome best practice, Jen. Thank you.
Sure.
Very good advice on that. Absolutely.
Okay. The last question that I've got is, will the recording be available? And that answer is yes. I will put it on YouTube. I'll put it on my website. And I will also put it on social media so that way you guys can review it. Todd, I really appreciate you doing this. Again, thank you so much. Hope to see you in July. And yeah, anybody that has additional questions, feel free to reach out to Todd or myself. You can get contracted using the link that's right there, or you can go to your upline, ask them if they have the contract. Odds are they do, and you can get signed up there as well. So thank you all. I hope you have a great week, and I will talk with all of you soon. Thank you.
Take care, everyone.
Thank you. Thank you, Todd.